Government of Somalia, Your Excellency Dr. Jama, the Minister of Health of Puntland, Your Excellency Ambassador Lindgren, Government of Sweden, Head of Development Corporation of Sweden Embassy, distinguished guests, international researchers who have come all the way to Puntland to attend this historical event, which is the first NIH Health Research Conference. A very good afternoon to you all. My name is Mamunur Malik. I'm the WHO country representative here. Let me give you some perspective of this research. Back in 1990, which was almost 30 years ago, we used to call a 10-90 gap. It's a very interesting phenomenon. 90% of the funds that are going for health research is addressing only 10% of the global health problems. And this is the disparity and the disconnect between what we see in the developing world and the money that is being spent in public health research. $73 billion annually is spent on public health research alone, both from the private and the public sector. The total GDP of the world is close to $97 trillion. So the researchers can calculate what is the amount of money, percentage of money that is going for the research. Now this is really a sort of concern for all of us. But let me give you another perspective. After that finding, a commission was set up. And the commission said few things which is still valid. That if that disparity is not changed, the world is going to see high burden of infectious diseases among poor, but that can be addressed with the existing cost-effective drugs. We'll continuously see increasing trade of TB, malaria, and HIV/AIDS. We will see increasing epidemics of non-communicable diseases such as heart disease, diabetes, and injuries in the low and middle income countries. And we will see disparities in efficiency and equitable health services in different populations. These statements were made about 30 years back. What we see now is the same thing. We see high burden of infectious diseases still prevalent in the low and middle income countries. On the top of it, what we see now is a high burden of non-communicable diseases. So what is important is to come out with a national health research agenda. And we also need to see that there is a greater collaboration between the private and the public sector, especially the universities. But one thing I must be very candid in saying, research should not be done only for the research. Research should contribute to policy settings. Research should contribute to something that improves health. That's the slogan, we improve the national health, and research should, one of the priorities of research is to improve the health. Now, there are some challenges, I do understand. Access to scientific publication is a big challenge. But let me just tell you, WHO has already provided HINARI services, which is access to scientific publications free. And I can promise that WHO will work with NIH and the state ministries of health to set up a state-of-the-art libraries in all the ministries of health building so that young researchers can have access to this state-of-the-library facilities so that they can enhance their research capability. Now, what is also important that 90%, if not 90%, at least 80% of the deaths that take place are due to diarrhea, and 50% of the deaths that take place due to malaria can be prevented with the existing drugs. But what is happening? The children suffering from diarrheal disease or the people suffering from malaria do not have access to these drugs because of the health infrastructure may not be adequate. There is problem with access, coverage, and equity. And that research should address these sort of issues that how can we do better in situations like Somalia? What interventions can be much more cost effective so that we address this disparity and children suffering from diarrheal disease, people suffering from malaria have access to the drugs, because the available drugs are enough to prevent these deaths. We don't need any more research. These drugs are enough, but the problem is people do not have access to these drugs because of the different issues related to inequity, related to inequality, and the research should address those things. Let me just thank National Institute of Health, my very good friend Abdi Fatah. I know he will complain I have not responded to his telephone calls of late, but his work was in my heart. We supported all through, and thanks to the Public Health Agency of Sweden as well, being a strong partner and also listening to the need of this country. So we work together to make all this difference that we aim to achieve over the next few years. I can also promise one thing. I will work with the Ministries of Health and also NIH to give reward to some young researchers every year, maybe 4 or 5. You please come out with some suggestions. Those rewards can be named under some very good researchers in Somalia whom you all respect and maybe admire. So under those names, let us try to fund some research which can be game changer. There are many things happening in this country, but let us try to prioritize some research work which we can support through National Institute of Health for the young researchers. Come out with a criteria, and we will love to support those research works, and those will be the game changer for this country. Thank you very much for giving me this opportunity to talk. To the young researchers, I have just few suggestions. Don't stay in the comfort zone. Challenge yourselves. There is nothing wrong in making a mistake. That's how we learn. Please help others. And I have heard copy and paste. Yeah, challenge yourselves. Try to do something original. And finally, I would like to thank the organizers for being a part of this history, because I think this is the first ever research conference which has been held. Thank you, Puntland, for hosting the first research conference. They need to be acknowledged, they need to be appreciated. And all the international researchers for your braveness, because you have come all the way to help them, to show your solidarity and commitment that we as a global community are with you. So please continue to make us happy, surprise us, and we are there to help you through. Thank you very much for giving me this opportunity to talk.